I join in Chairman Schweikert's in convening this very important hearing on accountability within the organ procurement organizations, or OPMs. This is not a partisan issue. It is not an abstract policy debate. This is about the life and death of more than 100,000 Americans who are waiting for a transplant right now. For years, independent reviews, including federal audits and Government Accountability Office reports and HHS Inspector General's investigations, have warned us that America's organ procurement system is underperforming, to say the least. So some OPMs do extraordinary work. Others lag far behind, with low recovery rates, poor management practices, and preventable lapse that could have saved lives. These failures are not theoretical. They have led to organs not being recovered because OPMs do not show up to hospitals in time or lack trained personnel, breakdowns in testing, documentation irregularities, and the list goes on and on. These systemic failures are sometimes described as organ procurement crisis. It is a crisis rooted in bad actors, but it's not bad actors alone. I believe that it is also a result of an outdated accountability structure that we in Congress could do something about. I come from Alabama, and I represent families who give and families who grieve. I believe that there are three simple principles for this hearing: transparency, accountability, and equity. When those principles are missing from organ procurement and autopsy practices, trust is broken and lives are harmed. There are several reported cases and lawsuits out in Alabama that illustrate why this committee hearing today is so important. Families of people who died when incarcerated in Alabama have reported receiving loved ones' bodies with internal organs missing, and have filed civil lawsuits alleging that these organs were retained or used without consent. Multiple news reports and national outlets have documented these families' complaint. These families have demanded answers and criminal investigations from the state officials, and they look to Congress to try to do something about it as well. It is also important to place Alabama's cases in a national context. In recent years, bipartisan Senate and House inquiries, as well as CMS and HRSA reviews, have documented systemic accountability issues and gaps. I believe that we must do more than just talk. We must do something about it. OPMs hold a unique position. They are federally designated monopolies, if you will, tax-exempt organizations entrusted with responsibility that no one else can perform. Congress has a duty to ensure that public trust is deserved and not assumed. We must provide vigilant oversight and implement reforms that will strengthen performance, modernize oversight, and protect patients and their families. I want to stress that this is not a partisan conversation. Both Democrats and Republicans have expressed deep concern about the failures within the OPM system. Administrations from both parties have proposed reforms, issued updated regulations, and called for greater accountability. And we must do both. I also want to highlight and hope that we will talk about the disparities that exist in organ procurement. Black Americans are 3 times more likely to suffer from kidney failure, yet they wait longer for placement on transplant lists and are less likely to receive a transplant. Communities of color face delayed referrals, lower access to transplant centers, and inconsistent communication from OPMs. Equity must be centered to ensure that we actually get it right. No community should be left behind simply because of where they live, how their hospital is resourced, or the color of their skin. Now, we must also recognize that all of these failures are happening in a time when my Republican colleagues have passed a bill that has gone to weaken Medicaid and Medicare and cause millions to lose and reduce their insurance. The bill that was passed in July created new barriers for patients seeking timely organ failure treatment and transplant referrals. Organ transplantation does not happen in isolation. It depends upon a stable coverage, chronic care management, and early detection, all of which become harder when patients lose access to affordable health care. Any policy that increases the ranks of uninsured inevitably worsens the transplant outcomes. In conclusion, accountability for OPMs is not optional. I believe it's essential. Lives depend upon us getting this right. Today, as we hear from witnesses and examine the failures of the current system, I hope that we keep one thing in mind. Every improvement we make has the potential to save a life, to shorten a family's grief, and to honor the generosity of donors whose final act is a gift of hope. Let us work together, Republicans and Democrats, to ensure that America's organ procurement system finally meets the standards our patients deserve. And with that, I yield back.